Hi, everyone. I am Dr. Diane Hayden, and you are listening to the Dr. Diane Show, where we explore revolutionary expansion of mind, body, and soul. Each time on the Dr. Diane Show, we will have experts from around the country discussing cutting-edge topics on longevity medicine, natural health, mindset, and soul purpose to help you shift your perspective and become a mindset warrior like me. I'm excited to have on my show today Jennifer Dubicki and Gigi Adduci. Jennifer has over 14 years of experience in traditional Chinese medicine, including acupuncture and herbology. She understands how to use food as therapy and used other holistic modalities, including homeopathy, for treating the root cause of illness. Gigi is one of the owners of Vitalized Performance Group located in Glastonbury, Connecticut. She is a certified colon hydrotherapist, and she trained in emotional freedom technique. She also has her certification in integrative health coaching and patient navigation, and strongly believes it is vital to combine different modalities and healthcare treatments to achieve your best health physically and emotionally. And you can learn more about both of them and Vitalized Performance Group at www.vpgwaves.com. That's Victor, Paul, Greg, waves.com. So welcome, Jennifer. We're going to be talking to you first. How are you today?
I'm good, Diane. Thanks for having us on today.
Awesome. Awesome. So we have some exciting stuff to talk about. You guys have a really cool novel modality. Simply, it's called Shockwave, and we're going to get into the more details of it, but you're using it there for both pain treatment and aesthetics. And I'm going to be talking to you about how you use this for pain, and then Gigi will jump in and we'll get into the whole aesthetics part of it. But it sounds pretty amazing. And I'm sure people, when they hear the word shockwave, are like, yeah, I'm not having that done.
Right.
So I guess the clinical term for it is something called EPAT, right? Extracorporeal pulse activation treatment.
Right. So people are going to call it EPAT. You're going to hear it called EWST. Other people are going to call it acoustic sound wave therapy. It's all the same thing. So basically what it is it's a pulse activation therapy. So small pulses are going to be used on muscle or fascia tissue, and it's going to be done very quickly and wherever there's pain. So we can treat tendinopathy, plantar fasciitis, heel spurs, knee pain, sciatica. You name the pain, we treat the pain, and we get quite good results here. Sessions are usually done in usually 6 to 12 sessions, depending on the severity of the pain. Sessions are usually in between 7 to 15 minutes.
Okay. Yeah. So actually, can we talk a little bit about how it, how exactly does it work?
So there's different hand pieces for each particular pain syndrome. So we pick the hand piece that best fits the area of the body.
Okay.
Then we'll assess the pain area. So let's just say it's the knee. We'll find the best suited hand piece for that area. We'll set up a pulse setting. So generally the pulses are in between 8 and 12,000 pulses. So that will equal out to be 7 to 15 minutes of pain treatment. And the pulses are done extremely quickly. So it will feel like a vibrating kind of sensation, and we'll move around the area. So the actual pain area, and then we'll move farther away from the pain area as well, because we don't just want to treat where the pain is. We want to treat distal areas from the pain, because we want to treat the muscle area and to bring more blood to the pain site as well. So what the shockwave treatment does is help to heal the area and bring more blood circulation by healing tissue in the area.
Right. So my understanding is when you're using something like that, essentially, well, the reason why sometimes we have pain or other dysfunction in the body like that, when it's related to muscular or nervous system or whatnot, is because the body is not bringing enough nutrients to heal it. And so by using a modality like this, it stimulates the body to be bringing more of those more blood flow. So therefore more nutrients to that area to basically heal whatever is going on in there and hopefully eliminate pain.
Right. It accelerates the healing metabolism in the body.
Right. Okay. And so you said, well, I guess the number one question that I'm sure people are thinking is, does this hurt? Is it painful?
So generally there isn't too much pain. There might be a slight second of discomfort at the pain site, but that doesn't last very long at all. So you might feel a little twinge, but as we'll move on, you won't feel anything at all. It's nothing to be concerned about.
Right.
There's no pain after the treatments. There's no downtime after the treatments. We might say, depending on the severity of the trauma, you might want to go home and rest. We're not going to say go out and, run a marathon.
Right.
But
yeah, well, the whole point of trying to get more blood flow into this area is to heal. So the last thing you want to do is now cause more stress to the situation, for sure.
Right.
Yeah, I haven't used this particular modality, but I worked with a practitioner down in Florida, actually, who had something similar. And so I've experienced it. I know what the feeling is. And for me, it was very, it almost felt like energy. Like it wasn't painful. It's not painful. You could definitely feel that something's going on, but it felt almost like, I don't know even how to explain it. Because I don't want to say like it was little pricks, like I've had electrolysis done. It's not like that. It's not, like needles or anything like that. But it's like this energy is the only way that I could describe it, right? Like feels like there's some, energy going from the device into, the area. And funny enough, it was on my knee, actually.
That's a really good way to describe it. In most places, it does feel like energy. Most patients that complain of pain are actually foot pain patients, but they already are coming in here in so much pain that the actual pain almost feels better to them during the treatments than the pain they're actually in. They actually get almost a pressure pain during the treatments. It's a relief to them than the foot pain that they're in.
Mm-hmm. Yep. That makes sense. So you said there was no downtime. I'm assuming no side effects or anything like that from it.
No, there are no side effects to the Shockwave. So we send you home. You can continue your normal routine.
Yep. So what kinds of issues do people typically use this for? Like what kinds of syndromes can you treat with it?
Golfers and tennis elbow, plantar fasciitis, shoulder pain, knee pain, sciatica is a big one that we see in here, tendinopathy, Morton's neuroma is another big one. Any sort of back pain we see in here. You kind of name the pain when
right.
You see the pain.
Yeah. And does it depend on how progressed? Like, let's say someone has worn down like a lot of, cartilage and and they're like somebody who's going to have like a hip replacement or a knee replacement or something like that. Is this something that would sort of prolong having to have that done?
So if you're at the point of replacement, this can help make you feel better while you're waiting for the replacement, but it's not going to replace the replacement.
Right.
Unfortunately, once the cartilage is gone, it's gone.
Yeah. Unless somebody comes up with another modality where we can regrow cartilage. Well, I mean, there's stem cells and things like that, but
right. This will, however, help scar tissue after surgery.
Oh, that's awesome.
So this can help you repair from surgery. So we do see a lot of patients who come here after replacements or after knee surgeries and things, and this will get them back on their feet faster.
That's awesome. Yeah. So,
Mhm.
so important to keep in mind, something to do like pre and post surgery for sure.
Right.
You know,
This is great for pre and post surgery.
yep. Cool. Um, what about other treatments? Is it, is Shockwave for pain combined with any other treatments that you guys typically see?
So this in our office is always combined with acupuncture. Because I am an acupuncturist, our patients are coming in here and they're coming in here looking for comprehensive treatments, and they're coming in here looking for the best way to get rid of their pain. And I find when we combine with acupuncture, they're getting pain relief very quickly. So we often combine with acupuncture, and they're leaving in here with amazing pain relief.
Wow, that's awesome. That is awesome. Yeah, I think most people do tend to turn to acupuncture for that for sure. And obviously this is just going to accelerate, I think, the effects of that as well. Now I know we had done a podcast a while back, and I think we were talking more specifically related to sexual dysfunction and using that.
Yes.
So you guys use that as well, right?
Yes, we do. We absolutely use the Shockwave for erectile dysfunction and Peyronie's disease. So in that case, what it does is it opens up the blood vessels, it clears up the microplaque in the area, regenerates the nerve endings, and brings blood flow to the area. So it can also be used for neuropathy in the feet as well in the hands. So we can use it also for Raynaud's as well.
Mm-hmm.
So it's used for a multitude of things. As research is coming more to light, Shockwave is used for all sorts of things.
Yeah, that's got to be awesome for diabetics too, right?
Absolutely.
Yep.
So for years, I was using just acupuncture for neuropathy in the feet and getting great results. And now that we're combining the two, we're getting feeling back in the feet for people who haven't had feeling in years.
Right. Well, it makes sense. I mean, it's stimulating blood flow, right? So, and like you said, opening up pathways and lots of times what's happened for, diabetics or other situations is the micro, like the tiny vasculature, tiny blood vessels start to break
Right.
down. So,
Those nerve endings. So
yep.
just like with our ED patients, it's starting to regenerate those nerve endings. So we're now using it on the feet. We're getting those nerve endings to fire back up.
That is awesome. That's
Mhm.
awesome. And what about, I'm sure there are ladies listening to this thinking, could we use that for sexual dysfunction in women too?
So absolutely, it can be used for that. So it can be used for vaginal dryness as well as for bladder leakage.
Yep. Okay. Right. Again, like I'm thinking like anything that is going to stimulate blood flow, which is going to get more nutrients to those areas, is going to help, whether it's reducing pain or it's stimulating, regrowth of things.
It's
So
definitely it's cutting edge medical technology. And the more that we research it, the more and more things it can be used for. And the great thing about it is that it is non-invasive. So
yeah,
there are no side effects of it. There's no downtime of it. I've never had a patient call me the next day and say, I'm not feeling that good, or it's made me worse, or I have a side effect from it, which is great.
yeah,
So
that is awesome. I know we're going to talk about aesthetics, but anything else that you guys use Shockwave for that we didn't mention? Any other types of
So
situations?
we do colonics in this office, and we have been using it prior to colonics for constipation and irritable bowel to help get a better release during the colonic. But we're also using it without the colonic just to help get the bowels moving. So we're
Yeah.
using it for that as well. So it's across the board. We're
Yeah.
using it for everything, and we're getting great results.
Yeah. I mean, it sounds too good to be true, but when you really think about what it does
Mhm.
in terms of just increasing blood flow, we've been saying this, all along,
Yeah.
obviously it makes sense that it could be used for all these different things and even, getting your bowels to work more effectively as well. Again, increasing blood flow,
Right.
increasing nutrients, increasing the ability, for those tissues to be healthier and function better.
So to give people a better idea on how deep the shockwave goes, the original device was developed to break up kidney stones.
Oh, wow.
So it can go that far into the body, into the organ system. So if you visualize the shockwave going that far into the system, into your organs, that's how deep the wave goes.
Wow.
So
Yeah.
it is that effective that it can go that far.
Yep. Yep. Yeah, that's awesome. That is awesome. Cool. Do we want to jump over and talk to Gigi a little bit and find
Yeah.
out what you guys are doing from an aesthetic standpoint? That would be
Absolutely.
great.
Okay, so I did bring our Shockwave device, our new one,
Oh, nice.
that I just bought. So we're gonna do a little show and tell, okay? So it's not hooked up, obviously. But this is the thing that we'll use for like cellulite or bigger areas on the body. And it's a big pounding sound. Do, 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 do. And it's breaking up, it's minimizing like fascia. So, cellulite is bunched up fascia. It's not actual fat pockets like people say it is. It's just bunched up fascia that's really tight and just created these bumps and lumps. So this can actually break through all that. So same thing with scar tissue, can break through it and just smoothing out the skin again.
Wow. That's all.
I know.
I wasn't talking because I wanted people to see the machine and what you were doing. So
Mhm. I have another one. So this is what we'll use for the erectile dysfunction. This is something we would use on the woman. Not us, it will be a doctor, a naturopath who can also do like pap smears and things like that. She can do all the stuff that GYNs can do, most of it. And they'll be performing the procedure. For erectile dysfunction, any of us can do it. So it's pretty simple because it's non-invasive. It doesn't go in too much for the men. It's just over the skin. It takes about less than 15 minutes. Painless, no recovery time. And that's all it is. And it's frequency energy. And this is the future.
yeah, I agree. I totally agree. That's awesome. So let's talk about the aesthetics part of it. What typical treatments do you do?
Again, Shockwave is all about getting blood flow anywhere you have lines, anywhere you have fascia. So pretty much we have fascia throughout the body, and where we can smooth out that fascia and get it to bounce back. So we're increasing collagen when we're doing that. We're getting blood flow, nutrition, all to that area.
Yep. Yep.
So that's pretty much your whole body.
Right. I know
Right?
it is amazing. But like, like we were saying, when you think about how the procedure works, it makes perfect sense because again, it's bringing, it's stimulating more blood flow. It's breaking down scar tissue. It's breaking, loosening the fascia. I don't know if we'd say breaking down, but all of that. So then, naturally things work better. And from an aesthetic standpoint, your skin is going to look much better, of course.
Mhm.
Yeah. Is Shockwave beneficial for any other skin issues?
Sure. I mean, you're bringing blood flow, nutrition to the area. So if you can't do it on an open sore, but if you can do it around there, it will help stimulate blood flow and maybe heal some ulcer, some places that might have grown an ulcer or hard to recover and things like that. But we combine things. So we would put something topical on it. We would maybe you'd see the acupuncturist just to get a little additional blood flow there. So I think the combining of the modalities is so important. The Shockwave works great, and we use it all the time on its own because there's some people that just don't believe in holistic medicine, and it's a shame. They don't even want to give it a try. But we still see even those guys, and it's usually my medical people, like medical doctors, surgeons, people like that don't take advantage of it. And but they're still getting results. I think they would get even more results in the overall wellness, of treatments if they included the colonics and they detoxed and I'm sorry, cleansed, not detoxed, and or if they did acupuncture or took advantage of the nutritional guidance from the naturopath. It's a shame. They want to skip all that and just do the shock. But even them, they're still getting a lot of they're better, so
Right.
it does work.
Yeah. Yeah. Why would you say, what makes Shockwave so much different than other aesthetic treatments?
Shockwave is a different thing. It's not laser. It's not based off of heat energy. It's based off of frequency. So if you're thinking of you're throwing a pebble into the water, it's kind of creating a ripple. And when that happens, it's getting deeper into the tissues and into like passing under the skin, underneath the fascia, underneath all of that. And it's getting deep into the right under the skin issues, right? So it doesn't go deep. This is a level 1 machine. A level 2 machine is something that a urologist office will use to break up a kidney stone. They have a level 3 machine that they're working on that is going to replace open heart surgery.
Oh, wow.
Yes. And they've been working on that since we opened, over 5 years. And they have open heart surgery. That might not be a thing anymore. No more open heart surgery. They can reduce to get blood flow through and crack any, break through the cloggages, the plaques and all that.
Yeah. Wow. That's really fascinating. Specifically for, I don't know how much you know about this, but I'll just ask the question and I'm sure we can, you can direct people on where to find more information specifically for let's say people who have heart disease, meaning they have blockages, or what about people who have functional issues like a heart valve repair or something like that?
I guess it's, I don't know if it will help that. I'm not sure.
Yeah.
Maybe.
That'd be
I like to think that the
fascinating.
body regenerates, and from what medical school tells us, it doesn't.
Right.
The heart doesn't.
Well,
and I hate to believe that. I'm hoping they're wrong. They've been wrong before. We can grow an entire organ, right? Or kidneys or liver. And I know it's a different, it's a muscle and I know it's different, but I'm hoping they're wrong. So that would be an amazing discovery.
Yeah. Yeah, totally. Totally. So you showed us the 2 different machines that you have based on whether you're treating for, pain or aesthetics. Is there any other difference in how you would treat someone for pain related issues versus someone with aesthetics?
Sure. So it's about how many treatments you would need. It's pretty much and how long the treatment is. So for our GAINSWave, our erectile dysfunction guys are more like between 6 and 12 treatments. They would come in every 6 months for a tune-up, just a 1 treatment. And then you'll have, for aesthetics, you would probably come in a little more sooner. It's about 4 treatments. It's shorter. You don't need as many, but you do come in maybe a little like every 3 months or every quarter, work with your accountant. Oh, it's time for a treatment just to get that, collagen. We kind of lose that as we age. Things just tend to go a little bit. So you just want to keep coming back and pumping it up with some supplementation, hydration, nutrition, that kind of thing.
Right. Right. What kinds of results are people seeing? I mean, are people doing this in replace of Botox or even plastic surgery, maybe?
Let me not step on any toes. I don't know. The people that we have here are scared of the knife or scared of Botox.
Yep.
We have very health conscious people that come here and they don't want toxins in their body and they want to do things a different way. So I can't compare the two.
Right. You can't compare, but people are choosing to do it in place of that. That's what I was trying to get at.
And I'm sure that people want to try this. That's non-invasive, no pain, no downtime. And it's probably more cost effective than having plastic surgery or something like that, or Botox. So I think they would try this before they would do that and see if it works for them. but a lot of people do like it. They like how it feels. You know, a lot of people just like, they can feel something working as they're on it. So it's been interesting. And we just opened it up. We just got this machine, and they have the smaller tips for the face and for the other parts that we haven't used the machine on others before. So we've been doing this for a few months. And so I don't have a lot of data, a lot of experience doing it, but you know, we've been trained, we know what we're doing. And so far we had about 50 people and they love it. You know?
Yeah. Yeah, that's awesome. I think you probably couldn't hear me when I was interviewing Jen I was telling her I've had something similar to this. It wasn't GAINSWave, but it was like a frequency medicine type of device. And I was saying how it felt like I was trying to explain to people, you know, like how did it feel? Because we were saying, you know, some people might think that it's going to hurt when they hear things like shockwave or whatever. But to me, it wasn't painful at all. It just felt like energy moving, like I was saying, I don't even really know how to explain it. It was just like I could feel like just energy, you know, coming from the machine, you know, into, I was having work done on the back of my knee, like into that area.
It's like a little tingly feeling, right?
Yeah.
Like almost like you're being electrocuted a little bit. You know,
I didn't want to say
not like
that
a
because
full blown, not a full
yeah,
blown.
it's not, it wasn't even like that. Like, you know how in the
It's just like
wintertime,
a tingly feeling, that's all.
right? You know how in the wintertime when you're walking and you get like a shock, you know, like
Yeah.
it didn't even feel like that to me.
No, it
Is
wasn't
a little
that bad.
painful. It's not like that at all. No,
No.
it's like yeah, it's like this little tingling sensation. I thought it was really cool. Really
Yeah, it's
cool.
a little, it tickles, you know, depending on the area, right? So
Right.
like I did hear Jen say, if it's on the foot and you have some plantar fasciitis or something, you will have, it might hurt a little bit, right? They're already having a lot of pain. It's very stiff, it's very tight. Things got to loosen up, move around. So,
Yeah, but
but
just like
yeah,
anything else, you know, if you're going to get myofascial release or physical therapy or anything like that, you know, you have to understand you might experience, you know, a little bit of pain because you got to break up scar tissue and, you know, get that area, get blood flow flowing more to that area. So then you're going to have more sensation. So there might be some, you know, mild pain, but I didn't experience anything like that.
it's less than a Swedish massage.
Yeah.
Or what's the other one that
Deep
what's
tissue.
the other one? The deep tissue.
Yeah.
It's less pain than that.
I agree. I agree
You know?
completely.
And
Completely.
facials, oh my goodness, I don't like facials. I know people love them. I'm not crazy about them. That's painful. I mean, we do Jen does acupuncture facials here.
Yep.
It's to replace Botox, but now we can use the machine with the acufacial. It's a game changer.
Yeah.
You know, you can get
Yep.
in deeper, and there's a lot of cool stuff going on here.
Yeah. Awesome. Awesome. And obviously, like you were saying, you can combine all different types of treatments with, you know, with the shockwave therapy for sure.
It definitely complements almost everybody that's here. You know, we have an acupuncturist. You have me and another woman here that does colon hydrotherapy. So we can blast the sections that will help stimulate for a better colonic, to get increased better blood flow. We combine acupuncture and shockwave. So
Yeah.
it's just pretty cool stuff.
Yeah. And it's exciting. I think it's cool to have a, you know, like a really cutting edge novel modality like this that is really, you're seeing great effectiveness for so many different issues and situations.
And I do want to announce that we're expanding to a new group, and we're going to do something even more. We have a few women under our belt already. The naturopath is, she needs a few more. So we're offering a really huge discount for women to come in, and if they qualify medically for sexual wellness using the shockwave device.
Oh, that's
and
awesome.
for the women, we're calling it acoustic wave. But yeah, so if you're listeners, or you know, if you see this online, just give us a call, write to us and let us know. It's a big promotion that we're offering to the women. we really want to have a lot of research and data on what it can do for the women and their sexual, like dryness, or that would be a great one. I think that will be a pretty easy fix with the Shockwave device. We already seen people that are already experiencing, and they just started and they're already getting some relief there. And we have other things going on, you know.
Awesome.
So we have it in urinary incontinence. Of course, you combine that with colonics and you do the Shockwave, that can really help.
Yeah. I mean, it sounds amazing on so many different levels. So people can learn more about you at www.vpgwaves.com. That's Victor Paul Greg waves.com. Definitely reach out to Gigi if you're interested in this study, for sure. And Gigi and Jennifer, I want to thank you so much for being with us today.
Thanks for having us, Diane.
Awesome. Awesome. This is Dr. Diane Hayden on the Dr. Diane Show. You can learn more about me at www.naturalnutmeg.com or www.essentialnaples.com. And I want to thank everybody for being with us today.